The turbulence surrounding you, these trying times that are so hard to endure. In the middle of what seems to be your darkest hour, hold fast your heart and be assured. This too shall pass, like every night that's come before it. He'll never give you more than you can bear. This too shall pass, so in this thought be comforted. It's in His hands. This too shall pass. I was brought to this world to preach to every kindred of His mercy and love. In every kindness I show, in everything that I do, I've been chosen by my God to testify. A woman of God, I'm His masterpiece, chosen, loved, and redeemed by His love. A new life I was given to serve. I accept your call. Here I am, my Lord. Wherever I go, I will tell, and forever will I shout and sing. Lord, I will go. About His redemptive love, sharing God's love and mercy, forgiveness and joy. I will not be afraid. God is walking by my side. I will go forward with His might. The ending is near. I will man of God, His masterpiece, chosen, loved, and redeemed by His love. A new life I was given to serve. I accept your call. Here I am, my Lord. Wherever I go, I will tell, and forever will I shout and sing. Lord, I will go. Masterpiece, chosen, loved, and redeemed by His Good night to all of you. And I am so glad that you are all here with us tonight. I want to welcome you to tonight's edition of TNT. It's the women's edition, a special edition for part of at least the first half of the year for sure, where we will be having some series that are catered specifically for women. Of course, we don't want to turn away any gentlemen because they can gather information as well from these sessions, but we just want you to be here. So welcome to the St. Thomas District of Seventh-day Adventists TNT Women's Edition, sponsored by the Women's Ministry Department of the Welchman Hall Seventh-day Adventist Church, one of the churches in the St. Thomas District. And we are under the leadership of Pastor Bernard Prescott. I'm so glad again that you are here. And just before we get into anything at all, I just want to invite God's presence as we prepare for tonight's topic. Let's bow our heads. Father, we thank you, Lord, for being with us throughout the week so far. We want to thank you for bringing us here so that we can gather together for another session. It's a topic, Lord, that some may not want to talk about, but we know that we need to be educated about a lot of things that are happening in our lives. And not just that we can gather the information for ourselves, but that we can also share it where we can help someone else as well. So I ask that you will be with us, be with the presenter, and all that will happen throughout this session tonight. This is my prayer in Jesus' precious name. Amen. Tonight's topic is the pause for me. And we are looking at a subject that some persons may think, or it has been taboo for a while. I don't know about if any of you have heard a lot, well, in my age group, who may have heard a lot about menopause, but I can say growing up, I did not hear a lot about it. It was a taboo subject. And even though it is something that's a natural transition for a woman, somehow it became a taboo subject and you did not hear a lot of persons talk about it. But yet you knew that there came a time in a woman's life where she went through some serious challenges. Some persons went through some serious challenges, had a lot of issues and different things. But because it was not spoken of, no one exactly knew what were some of the things that these ladies may have been going through. And as a result, there are a number of women who would have suffered in silence. I've come to know now that menopause can affect us in any way. It can affect our home life, it can affect our work life, it affects us physically, it affects us mentally, it affects us emotionally, so many things about it. So tonight we want to talk openly about menopause, and in particular, we want to talk about its effects on our mental health. Now, I am aware that no one experience is the same. I have heard from some persons who were bold enough to speak about it, where it is they said they had no kind of experience whatsoever. Things just happened naturally. They had no effects, nothing. I am so happy for them that they had that experience. But then there are some of us, and I say us, yes, because I have been playing what I call menopause bingo for about 2 years now, where I have this picture of all the different effects, all the things that you can get as you're going through. And I have been Xing off and ticking off as they came. So I could tell you about it, but I thought it would be better if we had someone who could come in and speak a little more about how it affects us mentally and how it affects our mental health. So tonight, our presenter, she's no stranger to some, I am sure, especially in our district, because she has presented to us before. But I want to tell you a little bit about our presenter tonight, whose name is Shante Walters. And Shante is a registered counseling psychologist.
here in Barbados, and she's also a member of the Barbados Psychological Society. She holds a Master of Science degree in counseling psychology from the University of the West Indies, and she's also one of the founders and directors of Life Intervention and Support Services, or LISS. And this is a clinical counseling agency. There, she provides psychological and therapeutic interventions for individuals, couples, and groups. Ms. Waters works on a voluntary basis as a supervisor for social work students in their final year of study, as well as students pursuing the Master of Science in Counseling Psychology from UW Cave Hill. She has also served on faculty with USC Barbados, teaching courses in behavioral sciences, counseling, and various aspects of psychology. But tonight, Shante will be here and she will be speaking to us on the pause and how it affects our mental health. We will take any questions at the end of the presentation, but knowing Shante, I am sure that she has something that she will put in between. So be prepared to answer some questions because I am sure that she has a mix of something in her presentation. So I'm just putting you on your guard, but you can also put together your questions that you may want to ask at the end of the session where we will have a Q&A. So Shante, we welcome you to the St. Thomas District of SDA, the Zoom session, the Zoom series, because you've been there in person more than once, but we want to welcome you to our Zoom and YouTube. I didn't even welcome our YouTubers. Welcome, welcome. Please forgive me for not welcoming you in my earlier welcome. I want to thank you for being locked on as well. And remember, if you have any questions as well on YouTube, just put them in the chat. I will get them so that your questions can be answered. Here we are, Shante.
Hi, good night, everybody.
It's over to you.
Thank you so much for the invitation, for the introduction, for putting everybody on their guard as to how the presentation may go. And I hope that as we go through the presentation, that whatever questions you have, whatever comments you have, you can feel free, as Nicole said, to put some in the car park until the end. But if it's a burning concern, a burning question or comment, feel free to raise your hand, and I'm sure Nicole will indicate for me so that I can respond. I think we're going to have an exciting time tonight. And what I would say, Nicole, I'm very, very happy for those persons who have gone through this phase without any challenges. Very happy for them. All right, so I'm going to share my screen with you. Let me just pull it up here. And we're going to get started. Okay. Let me just bank these controls. Can everything on the screen be seen? Okay, excellent. Yes. So it's the pause for me. I don't know if it's the pause for you, but it's the pause for me. So we're going to be looking at mental health and menopause. So what we want to be able to achieve by the end of our time together, we want to define mental health because we need to understand what we're speaking about. We want to define menopause and its related terms, identify the signs and symptoms, physically, emotionally, psychologically, show how mental health is impacted, and then discuss any suggested remedies or solutions. And I'm sure that there are remedies that we have not heard of in this group that you can share with us, especially those who may not just be sailing through, something that we can try. All right, so what is mental health? This is the definition that we're going to be working with, because I know that lots of times when we say mental health, most of the time we think of mental illness. We think of people being psychiatrically ill or confined to the psychiatric hospital or C4 at the QEH hospital. But when we say mental health, we're using the World Health Organization definition, which says mental health is a state of well-being in which an individual realizes his or her own abilities. That's the first thing. Realizes his or her own abilities, can cope with the normal stresses of life. Number 2, can work productively. Number 3, and is able to make a contribution to his or her community. Number 4. Now, I don't know how many persons, when you hear the term mental health, these are the things that you think about. The ability to cope with the normal stresses of life, realizing your own abilities, working productively, and being able to make a contribution to your society. Just moving the meeting controls again. All right, so menopause, what is it? And before I jump into this, let me say we're going through these signs and these symptoms and these definitions because when we think of health, lots of times we think of physical health over here in one corner, mental health over here in another, spiritual in another, social in another, and we have them all in their own little pockets, in their own little boxes. But the reality is that each aspect of health impacts the other. They all interact. So our physical health or lack thereof is going to impact our mental health. Our mental health is going to impact our physical health. They're all connected. So menopause is a normal natural event. We all know this. And is defined officially as the final menstrual period, confirmed after 1 year of no bleeding. So you have to go a full year without bleeding. And after that, you're confirmed to be in menopause. Now, it represents the permanent cessation of menses resulting from loss of ovarian follicular function, and is usually due to aging. So again, it's natural, it's expected when you reach a certain age. It happens spontaneously, and usually for most persons around the age of 51. But it can also happen prematurely. And this is from medical intervention. If you have a bilateral oophorectomy, that is if your ovaries are removed, both of them, or you have had cancer and you have had to have chemotherapy, or if there's any situation where you had impaired ovarian function, all of these things can lead to menopause. Some terms that we need to understand. Perimenopause. Now, this is the time around menopause and is also called the menopause transition. So this is when you're now starting to go into it. And this is the most symptomatic phase for women. So this is when most persons will start to say they're experiencing all of these different physical effects. Perimenopause. Next term, induced menopause. Now, this is the cessation of menstruation that follows the oophorectomy. That is the removal of the ovaries, and this is with or without a hysterectomy. So there's some persons who don't have a hysterectomy, but they have the ovaries removed. Or chemotherapy, or pelvic radiation therapy, or what's that? Iatrogenic menopause. That last one, that is if you have a hysterectomy, but you do not have the ovaries removed. When that happens, you are more likely to go into menopause earlier than if you did not have the hysterectomy. Premature menopause, any menopause that occurs before age 40. So regardless of the cause, once it's before age 40, it's considered premature menopause. Primary ovarian insufficiency, and this is a continuum of impaired ovarian function leading to amenorrhea, that is stopping of bleeding in women younger than age 40 and postmenopause. The years after the final menstrual period resulting from natural or spontaneous or premature menopause. That's when we're going through it, that's where we want to get. Now, with our current life expectancy, these stats are from North America, but if you really think about it, the postmenopausal years make up 1/3 to 1/2 of the lifespan of most women. Now, again, these stats are from North America, but if you go through menopause and you're there by 50, the life expectancy, 70, 80, it would make up 1/3 to 1/2 of your life. So, the signs and the symptoms. So what I want you to do as we go through these, But those of us who may be in this age range, those of us who may be, and those of us who may not be, I want you to tick off the things that you may have experienced or that you may have heard of other persons experiencing. At least then all of us should be able to get one or two things. So, change in menstrual cycle patterns. These are the classic symptoms. This can refer to any of these things here. It becomes lighter, becomes heavier, longer, shorter. You miss some periods in between, or it goes back to when it first started and it wasn't regular. Vasomotor symptoms. These are the ones that we talk about a lot. The hot flashes, the night sweats, the waking up in a pool of water and the bed soaked. This heat coming from inside that you can't figure out how to stop it. Right. The vulvovaginal symptoms. Vaginal dryness, itching, irritation, dyspareunia, which is painful intercourse or bleeding after intercourse. These are the classic symptoms of menopause. Now, this is just a graphic for you showing the hot flash. So to the far left, you would see core body temperature, the skin and blood flow, and the heart rate. And you see where the thermometer is. What happens when you're having the hot flash is that your core body temperature goes up. So there's an intense feeling of heat with reddening of the upper body, what some of us would refer to as being flushed. And when that happens, again, it's this heat that you just cannot figure out what to do with it. Then you have the next image, the heart rate peak, and the skin and the blood flow peak, and you start to sweat. So you see in the image, the lady, she is sweating, and then you move from being suddenly so hot to being suddenly so cold, because your core body temperature then suddenly plummets and you become cold. And this is not something you can predict. It is not something you can say it's going to happen tonight and not tomorrow morning. It can happen at any point in any environment. And you just have to figure out what you're going to do when it happens or how to deal with it. Now, other symptoms, which are sometimes associated with menopause. So the classic symptoms are the symptoms that most persons would experience or would speak of at one point or the other. These other symptoms now, they vary from person to person. So the first one, sleep disturbances, and this is outside of the night sweats. So where before you were sleeping 8 hours, 7 hours, how many ever hours you were accustomed sleeping, and you would have a good night's sleep, you realize that now you're unable to sleep and you don't know why. Trying to sleep, you're doing everything they say, go to sleep at the usual time, all those things, but you're unable to sleep. Cognitive concerns, memory, start to forget things. And sometimes things that you've known for years, sometimes people's names. Sometimes you're driving and forget your way home. That might seem ridiculous to some persons, but these things do happen. Concentration, your attention span seems to be shortened at times. You may be in a meeting, you may be in the Zoom meeting right now, and 1 minute you're listening, and the next minute you have no idea where your mind is. It's not that you've intentionally started to think about something else. You're just not following it anymore. That is an issue for some persons. Emotional challenges. Menopause is rife with self-esteem issues for a lot of females. The way that we view ourselves starts to change. And that as we go on and speak about some of the other issues that come up, you would understand why for some persons, the way we see ourselves changes. A lot of women report that they feel less than, and they start to mourn the person that they knew themselves to be before they went into menopause. Psychological symptoms. Lots of women experience depression, during menopause, anxiety, and moodiness. So before where persons would be saying, making comments, if you're emotional or a bit more sensitive, that you're probably on your period or something to that effect. Now it is, you have to be going through menopause. Something has to be wrong with you. Why are you behaving like that? And for a lot of the women, they're unable to say what it is that is stressing them, what it is that has them feeling so sensitive or so upset. And it's not that they don't want to explain it, they're just unable to articulate it, to put it into words, because they themselves don't understand it. Other issues, hair loss, hair thinning. Lots of us, we end up with some nice short hairstyles during menopause because the hair starts to thin, especially in the top hair. Well, it usually starts here. And the part that you would have, the nice thin part, it starts to get wider and wider. Everybody notices it. And we do everything that we can to hide it. And then we eventually say, you know what? We'll just cut the hair. I see Sister Nicole is laughing. I'm sure there's some things that you can identify with here.
I could probably just put my head down and show you.
Understood. I can do this here. Weight gain. Now, there's some of us who may have been a particular size our entire life, never had any challenges maintaining that size, whether it was considered thin or not, but whatever size we were. But we go into menopause and then we start having challenges maintaining. We're not eating anymore. Some persons are eating way less because they don't really have the appetite or the interest, but they start to gain weight. And when the levels of estrogen in your body start to fall, and the levels of testosterone may start to rise, you start to gain weight. So all of these different things happen when we're going through menopause. Now, to speak specifically about mental health, I hope that you were able to take off some of those things, whether they were personal experiences or experiences that you've heard of or seen in other persons. I have a lot of them ticked off for myself personally. Now, anxiety and depression, along with sleep, are interlinked. So they're all connected. Remember I said we have these things in these boxes and we look at them individually, but they're all connected. Sleep, anxiety, and depression. Now, anxiety and depression can trigger our sleep issues. So if you have a challenge with anxiety, even prior to menopause, or have had a challenge with depression, you would know that your sleep is impacted. We also know that when our sleep is impacted, our moods are impacted. Our ability to function as we would want to, as is required, is impacted. Our drive at times is impacted just because we are lacking sleep. So sleep problems and sleeplessness can make both anxiety and depression worse. Now that's a point to note as we continue. Now, the hormonal imbalances of menopause can lead to other changes within our brain chemistry. So we're going to do a bit of neuroscience right now. Now, estrogen and serotonin are connected. Serotonin is a neurotransmitter in our brain, or a hormone in our brain. It's how the neurons in our brain, how they communicate with each other using these chemicals. Now, our estrogen levels have a significant impact on this chemical, serotonin. Serotonin is responsible for our feelings of happiness, and it helps us to maintain a stable mood. It's called the feel-good hormone. So when the levels of serotonin in our body are where they should be, and the chemicals are working as they should within our brain, our moods are stable, we feel good, we can do the things that we have to do. However, when there's a shift in the serotonin in our brain, we have challenges. Lots of persons who have depression as a diagnosis, who have anxiety as a diagnosis, or even if they have a temporal depression or anxiety, lots of times they need to have the serotonin, the chemical within their brain. They need to have some medication to help balance that. So we're speaking of a natural event in our lives that causes the levels of estrogen in our body to fall. And that estrogen being at a certain level impacts the serotonin, which is the chemical in our brain that helps us to feel good and that helps us to be happy, or to recognize when we're happy and the situations that make us happy, and helps to keep our mood stable. Now, this doesn't happen to everybody, but it happens to a lot of persons. Estrogen helps to stimulate the production and the transmission of serotonin and prevents it from being broken down. So when there's not enough estrogen present during menopause, the levels of the serotonin will drop, which can cause us to feel depressed. Now, there are a number of causes for depression, or a number of ways in which persons are diagnosed with depression, let me put it that way. For some persons, it's hereditary, so it's in your genes. For other persons, it is stressful life events. Something happens, a mass event like COVID, a mass event like the unfortunate situation in our sister island right now, the volcano. Those stressful life events can cause somebody to become depressed. But the third way is when there's a shift in the chemicals in the brain. And menopause, because of the way that it works, results in a shift in the chemicals in the brain. Now, estrogen is also connected to cortisol. Now, cortisol is what is known as the stress hormone. Normally, estrogen helps to keep the cortisol levels low, and it's good when it's low. But when the levels drop during menopause, again, the cortisol levels go up. And when that happens, the studies and the research has shown that that can also lead to depression. So it seems as though these natural occurrences, or this natural occurrence, has great potential to impact our mental health just by the way the hormones are operating. The estrogen falls, the serotonin levels are impacted, the cortisol levels are impacted, and they can lead us to being depressed. They can lead us to having anxiety. Other menopausal symptoms. The symptoms such as the hot flashes, anxiety, the insomnia, you're just trying to sleep and just can't get it done, can also lead to depression because we're confused, we're frustrated, we're upset. We just want to have a good night's sleep. We just want the situation to settle down, to feel as though we have some sort of control, as opposed to this situation is controlling us. They can lead to depression. The physical and emotional stress that they can inflict on us as women is great. I'm going to pause here before I continue. Do we have any questions or any comments about anything that I've said before? I hope that means that it's very clear and not that we're just can't speak at this moment.
Maybe it is. I am not seeing any.
Okay, that's fine.
Questions as yet. Yeah.
That's fine. All right. So, tips, tricks, and treatment. We're going to spend a bit of time looking at these things. And I just want to underscore in your mind again the fact that all aspects of health are connected. So although some of these things may seem as though they're treating the physical symptom, remember, when we have challenges with our physical health, it impacts our mental health. So we need to treat each aspect, each challenge that we're having. Now, the treatment for depression and anxiety, just a bit of knowledge for you to understand. Depression is treated with medication, with talk therapy, with lifestyle changes. Anxiety is treated with medication, talk therapy, lifestyle changes, and employing stress management techniques. It's not one thing and not the other. It's a combination. So you will not be successful in treating depression with medication alone. It needs to be medication in conjunction with therapy and lifestyle changes. And the same for anxiety. It needs to be a combination of those things. So as we go through these tips, tricks, and these treatment modalities, I want you to think about those categories: medication, therapy, lifestyle changes, stress management techniques, and see where they all fall. So let's start with the vaginal symptoms. Now remember, we spoke about the itching, the vaginal thinning, the walls of the vagina being thinner. We spoke about pain. We spoke about diminished lubrication, those things. The way that this is treated, and this is usually done by the medical doctor, but there are also the mental health practitioners and some other persons that we will explore. So there's vaginal estrogen, which can be given, and that is to help with the itching, the elasticity of the vagina itself, the vaginal dryness. I've heard some women speak about walking and feeling as though their vagina was two pieces of sandpaper rubbing together. The vaginal estrogen helps to restore the lubrication and stop that dryness and stop that issue, because you know that we have a natural lubrication, and going through menopause, that diminishes for some persons or for most persons. So the vaginal estrogen is prescribed for those individuals. Lubricants. There's some individuals who may not need the estrogen and they choose to use a lubricant. There are many water-based lubricants that persons can just buy over the counter and they can use if the dryness is too much for them. The lubricants are used in tandem with intercourse to make the process easier or to replace the natural lubrication. But not I have intercourse on its own, separate. I don't have it connected to lubricants, because for some persons, intercourse itself is a treatment for the vaginal symptoms, the vaginal issues. Because what it does, it helps to, if you think about it literally, stretch and exercise the vaginal tissue to make it more supple, to encourage more lubrication and stop it from being so dry. Then we have physiotherapy. There is pelvic physiotherapy that some persons may be referred to, and this is internal physiotherapy. So while you may go to physiotherapy for your shoulder, your knee, or whatever, the pelvic physiotherapy, they're working in the vagina, whether with tools similar to TENS machines or with their hands. But again, that is about stretching and manipulating the vaginal tissue to reduce the situations or the issues that are being experienced by the individual. We have Kegel exercises, and I know that most of us, if not all of us, would have heard about that. The Kegel exercises are exercises that you can do every day on your own, and nobody knows that you're doing them. You just squeeze basically as though you're trying to hold in urine, and hold it as long as you can to help strengthen the muscles in the pelvis and in that area. And then I have here vibrator. Anybody wish to venture a guess as to why vibrator is here on its own? I can only see Nicole's face, so I have to just respond to her. No.
Some may think that that is just as taboo as talking about menopause.
Yes, so that's why I have it here. I think I have it here somewhere else as well. Yes, further down with the incontinence. So let me explain the vibrator situation now. I know that our education, our socialization, as I'm the Adventist, say certain things to us. The vibrator is not used for the purpose of intercourse in this scenario. The vibrator is a tool that you are asked to use with specific instructions. Again, it is to address particular parts of your vagina or particular areas. So the physiotherapist or the medical doctor who's working with you would basically coach you as to how to use it, because you want to apply pressure to particular areas. You want to be able to massage particular areas. Now, some persons might ask, so why can't we just do this with intercourse? But if you think about it, intercourse is not scripted like that. It is not, we must touch this particular point. It is not like that. The vibrator is just a tool, and it would be used because it has the appropriate shape. The ones that they have now have the appropriate flexibility to reach the particular areas that need to be reached in order to address the challenges that are being faced. Just to skip back to the physiotherapy with the TENS machine. The TENS machine, if you go to pelvic physiotherapy, I've done that before. There is, if you know what a TENS machine is like, there's a probe that looks like a vibrator. It's just a bit smaller that you have to purchase for yourself. Obviously, it's going internal, so you can't be using somebody else's probe. So you purchase the probe and it's connected to the machine. And the machine has particular pulses or modes that the physiotherapist would set it to. So it may pulse like that, or it may pulse faster. It may be more intense, maybe a stronger pulse, because it's an electric machine that's sending pulses, and it would address particular areas. Again, it has the particular shape that is required for insertion. And the final thing, when I was preparing this, somebody said to me, so what about the people who are married? Now, I think for a lot of us, the assumption is that marriage equals intercourse. But there are a lot of persons that are married and there's no intercourse. So that is something the physiotherapy, the vibrator, these other tools, these other methods, they help with all of those situations. So when you think vibrator, don't think not something I'm supposed to use, something negative, something not Christian. It is just a tool, basically. Now, I'm sure there may be some questions or comments about that at the end. Sleep. Now, we're at tips and tricks and treatment. Sleep is very important. And some of the suggestions that came when it was relating to sleep said no hot drinks before bed. I love a hot cup of ginger tea or something nice and warm and soothing before I go to sleep. And I said to myself, this is something that I have to look at. So the recommendation is to have something cool. If you must have something cool before you go to bed. A sleep routine is important. That's important when we're dealing with depression, when we're dealing with anxiety, because we need to prioritize our sleep. And a sleep routine is basically a ritual that you do. So for instance, you may go to bed at 9 o'clock. So at 8:30, you start preparing to get into the bed at night. You may, as most persons do, close all the windows, check to make sure the gas is turned off, go brush your teeth, use the bathroom, say your prayers or have a devotion. Some people do bed yoga, but you have a particular pattern that you follow. The suggestion is that it becomes a set pattern, because what it does, it programs your body basically to prepare for sleep. So as soon as you start doing step 1, step 2, step 3, your mind says, oh, it's time to sleep. And your body starts to settle into the mode of sleep. Rituals are also inclusive of a relaxation technique. So we would recommend deep breathing before you go off to sleep, after you said your prayers and you go into bed, or a visualization perhaps, or progressive muscle relaxation. These are all stress management techniques that can be taught. There are multiple scripts and examples all over the internet, all over YouTube that you can find, some longer than others, some shorter than others. I mentioned the bed yoga. The nighttime bed yoga sequence is a series of stretches that you do in your bed, not the real serious yoga that has you tired and contorted or anything like that, but stretches that help you to relax, to go to sleep. So it's important that if you're having challenges with sleep, that you consider developing a sleep routine. There's also medication that some persons may ultimately have to use to help them to sleep. One of the more popular ones is melatonin. That is something that can be bought over the counter, and it helps you to sleep. There are herbal remedies, I'm sure, that some persons here may be able to share, that help you to relax. Again, some teas. I know a lot of persons like herbal teas, but you can also have that as a cool drink. Use the same tea bag, whatever it is that you like, whether it's chamomile, peppermint, whatever. Use the same bag, but in cool water, or you can steep it in the hot water and then put it in the fridge to cool, or put ice in it so that you're having it cool, but you still have the benefit and the taste as though it were tea. Well, it still tea, is iced tea. Now, in terms of incontinence, this is an issue which many persons in perimenopause also experience, where there is leakage of urine from the bladder that you cannot control. Not necessarily gushes of urine, but for a lot of persons, it's a drip, 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 drip throughout the day. So persons may have to use particular types of panty liners or particular types of pads that are made for incontinence. In terms of this, the suggestion is, again, the Kegel exercises, physiotherapy. The pelvic physiotherapy helps with that. Vibrator, the vaginal exercises to help to train those muscles to hold the urine. Now, I know that person say that once you pass 40, just give up on this sleeping through the whole night thing. Just give up on it, sleeping through the whole night. And it's not a matter of, oh, I need to use the bathroom, but I can wait. It is, you better get up now or you're going to wet your bed. So with incontinence, it's kind of tricky because they usually say you still need to try to hold the urine as long as you can, because the more you go to the bathroom, for instance, you may have been going once and now you're going 5 times during the night, the weaker your bladder is going to get. So you need to try to hold and train your bladder with the Kegel exercises. But at the same time, you're not to try to stay the entire night without going to the bathroom. Incontinence is definitely an issue that comes with perimenopause and through menopause for a lot of persons, and it can be very challenging. terms of your mood, this we know, exercise is a big thing. Exercise releases feel-good hormones. When we exercise, we may be tired physically, but we feel better about ourselves. So we need to exercise. Persons with depression and persons with anxiety, we always encourage them to start an exercise routine. It doesn't have to be boot camp. It doesn't have to be 7 days a week, but any movement is better than no movement. So exercise is important. Exercise also will help with the self-esteem issues. It will help with the sleep issues. It will help with your flexibility. It will help with so many things. Diet is also important. Lots of times we need to adjust our diet when we are going through menopause. Start looking at foods that make us feel good, make us feel better when we eat them. I don't know if you've ever had a meal and when you finish eating it, you felt down in the dumps. You know what does that to us? I see Nicole like, no, I don't think so. What does that to us? A lot of the processed foods and a lot of fried foods and a lot of oily and fatty and greasy foods, they make us very tired. They may cause us to feel as though we're just going to go and sleep for a few hours and catch ourselves and then get back up and do something else. We want foods that give us energy and make us feel uplifted. Yes, you can have your comfort food once in a while, but as a rule, it's not something you should have every day or every week. So you might need to adjust our diet. There are also aspects of diet that help with some of these other symptoms as well. So an herbal doctor may be an option for you, for those persons who do not necessarily go to the traditional medical practitioners or a combination of the two, or do some research to see what you can try for yourself. Self-care, my soapbox, it's a big thing. I know lots of times we say to people, you know, you're not your clothing, you're not the way your hair is done and those things. But ladies, we know when we having a bad day and we take out that nice dress or that nice suit and those nice shoes and that on-point bag and we step out, it does something for us. So we need to invest, not necessarily in all these material things, but we need to invest in ourselves and in the way that we take care of ourselves. Take the time to pamper ourselves and to do things for ourselves, to take care of our physical body, and that will help to take care of our emotional body. Self-care also involves taking breaks, eating lunch or taking lunch, because lunch is not always about eating or only about eating. Lunch is about a break in the middle of the day to reset, to go again, to get through the rest of the day. All those things. Lots of us, 2, 3, 4 o'clock comes and we haven't eaten anything. That is not good self-care practice. Drinking water, all those things, diet, exercise, all of that falls under self-care. We need to take the time to take care of ourselves because that will impact our mood, it will impact our sleep, it will impact a whole lot of things. Mindfulness, this is a practice of focusing on the present. Granny always said, don't borrow sorrow from tomorrow. So as opposed to worrying about the things that have passed and we can't do anything about them, and worrying about the things that are yet to come, which we can't do anything about either, we need to focus in the moment. And sometimes it comes down to something as specific as, I am making my bed at this moment. I am just going to focus on that. I'm not thinking about what I'm going to do after. I'm just going to make the bed and then move on to the next thing. It helps us to control the anxiety. It helps us to lower the stress. So just focus in the moment as we go through the day. It also helps us to be more productive, interestingly enough, because we're not having the worries of what's going to happen in the next 5 hours. Gratitude impacts our mood. Being thankful for the things that we have, for the moment that we have, for the ability to do something. I know there are a lot of things that we take for granted, and it's only when they're taken from us or when we see what it is like not to have it that we realize. I don't know how many of you have ever had surgery and came home and went to the bathroom and realized how low the toilets are all of a sudden. All these years you never thought about it, and in the hospital the toilets are raised, but you come home and you realize, I get down there but I'm not sure I can get back up. That might seem ridiculous, but that is something to be thankful for. You can get up, you can walk, you have a meal that you can prepare. It might not be what you want every day, but you have something. Looking for things, little things that we can be thankful for, and practicing gratitude. The stress management techniques that I would have mentioned before, the deep breathing, visualization, the progressive muscle relaxation, investing in those and learning those will help with the mood, and in turn, they will spill over into these other areas. Hormone therapy. Now, this is this section, stuff that the doctor will prescribe for you if they believe that it's needed. If you're working on those other things and is not as productive as you need it to be, some of us may need hormone therapy. The vaginal estrogen that I spoke of before, their estrogen patches. There's some of us who can't take any form of estrogen, whether it's a phytoestrogen or estrogen, pure estrogen itself. For instance, I cannot have any estrogen at all. So I can't take a female vitamin because they have estrogen. In 2 days, I'll be very ill. There's some persons like that. But then there are others who estrogen, the estrogen levels are falling. So they get an estrogen patch, they get the vaginal estrogen, and they're moodless. They're able to do more. They're able to function better. The experiences that they were having are not as many. There are also many herbal remedies and formulations. Again, the herbal doctors, I would recommend. The persons who make their own tinctures from the herbs, from the base of the herb themselves. These persons have studied that aspect of medicine, and they can make you an herbal formulation that does the same thing as the synthetic ones or the traditional medical ones. Sometimes we need these. This next set of drugs are prescription drugs that persons will be given for anxiety, for depression. Antidepressants, the SSRIs and the SNRIs, they're just some of the names there, but the name of the medication itself is not necessarily what is the most important thing. It's understanding how it works. So the SSRI, that stands for selective serotonin reuptake inhibitor. That works on the serotonin that I spoke of before in your brain. It helps to balance out the serotonin levels, helps it not to break, helps it to work properly, which will in turn impact
Just
your
getting a
mood.
quick hello. I just here looking at this thing here. But
Okay, the SNRIs are selective norepinephrine reuptake inhibitors. These work on norepinephrine. This is another neurotransmitter in the brain that is impacted when we have depression or we have anxiety. It works on norepinephrine and the serotonin as well. So this is some of the medication that you may get if the doctor diagnoses you as depressed. However, these other types of medication you may also get if you have anxiety or depression. And sometimes there's some of us taking them for other things, but we don't realize that medication has multiple purposes. Anticonvulsant gabapentin is a medication. I know you probably heard about Lyrica. These are Neurontin. These medications work on our nerves. So the persons who may have nerve pain, and they may be prescribed the gabapentin or the Lyrica or the Neurontin. But this is also something that you may get if you have anxiety or depressed. Antihypertensive, lots of the high blood pressure medication is medication that is given for persons who have anxiety. Because if you think of it, when you are having an anxious moment, when you're having an anxiety attack, your blood pressure goes up. So one way of controlling it is to have medication that controls the blood pressure, as opposed to having medication that works on the neurotransmitters in your brain if that is not what you need. And then the pregabalin, it's also medication that is for nerve pain. But these are medications that may be given for anxiety, for depression, but they have the added effect of helping with menopause. Because again, physical health, mental health, social health, spiritual health, they're all connected. So if you address the physical issues individually, that will help with your mental health. If you address the mental health issues from the level of the brain or the level of the pain and the situations that you're experiencing, that will help with your physical health. So it's almost like a circle. One thing impacts the other. And there we are. So let me unshare my screen. And then let's have those questions and those comments.
Wow.
I know that was a mouthful.
Oh, it was
and an
it
earful.
was a good mouthful. It was a good mouthful and a good earful. I am sure much food for thought and a lot of tips. I got one question from one person,
Okay, yes, please.
and this question is, the question was, is over oiling of the vagina a bad thing?
What does the person mean by oiling? I think that's my first thought. Let me just say this.
Not sure that.
Okay, so oil is
I
not
don't know
something
if
that we
that's
put in the
probably talking
vagina.
about. Okay. Oh, okay.
That's why I said, what does the person mean by oiling?
Okay.
But I would assume that they mean the lubricants that I was speaking of.
Okay, I'm
You're asking them?
not sure. I'll have to ask the person.
All
But
right. So while you clarify that.
I hope that they have heard you and that they will message me back. And
okay. So while you get that clarification, the lubricants that we would put in the vagina are usually water-based, and they are not things that we have at home normally. We would have to go to the pharmacy and purchase them. There's to be no oil, no olive oil, no coconut oil, no any type of oil.
Okay.
Placed in the vagina. Because remember, the vagina is an environment that cleans itself and it has a lot of good bacteria. So if we put any oil or anything like that in the vagina, even soap, for instance, in the vagina, we run the risk of damaging the bacteria and having problems, having vaginal infections, creating situations where we have the itching, the burning, all those experiences that we don't want to have. So there's to be no oil put in the vagina.
Okay, I have a clarification then. Okay. No. She actually meant the natural oils of the vagina. So I guess that means if it is that you have actual,
like a lot of
your
it?
vagina is a lot, yes. So
Okay.
the natural oils from your vagina then, not using any
something
oil
external. Okay.
Yes, nothing external.
Okay. Each of us has our own, I guess, what's natural for us and what's normal for us. So it's not a situation where you can say X amount is normal and anything beyond that is not. There's some of us who have naturally a lot of discharge daily, and there's some of us who have very little discharge daily, but there is some. I think the key is for us to know what is normal for us and what is not. So in terms of discharge or oil, whatever we choose to call it, that occurs naturally or when we become sexually aroused. Once it does not smell, is not a weird color, does not itch or burn or cause any of those sort of issues, then it's fine. Usually I would suggest, well, as parents, when we're speaking to our girls as they grow, they need to start understanding what their body smells like, what is normal for them, so that the moment that there is external bacteria introduced, whether it is we change the laundry soap that their underwear is washed with and they have a reaction to it or whatever, that they would know. Yeah. So once we know what's normal for us. I saw some questions pop up. I need to open the chat.
Yes. So I'm going in. So one, I have someone who raised their hand. So I'll come to you shortly, Glendine. I saw your raised hand. But this one is, other than antidepressants and medication, what else can be used to reduce or get rid of hot flashes?
Hot flashes. The suggestions for hot flashes would be to avoid the hot drinks, generally, the hot things, the hot beverages.
But sometimes they don't only come at night. Sometimes
Right.
you're just sitting very
I just meant generally.
during the day.
Yes. Layer your clothing. So have clothing that you can take off layers and put on layers.
Okay.
And clothing made from cotton. Clothing that the fibers or the material that is made from is breathable, as opposed to some of the other synthetic fabrics that keep us hotter. But in terms of stopping the hot flashes, there's not a whole lot of things that we can do to stop them. It is more a matter of managing them when they come.
Okay, well, that's an interesting thing you just said about layering clothes. That's the furthest thing from my mind about layering clothes. Less is best.
I heard a sister say to me once, she would usually put like a camisole under her clothing, and not because it's not going to keep her hotter, but she has a hot flash. Remember, we went from the body being, the core temperature being stable, then to being so hot and you're flushed, and then it dropping and you're freezing, so you start to sweat, that it would stop the sweat from soaking through all of her clothing. Because she said that when she would have that situation, then her entire clothing will be soaked except where her underwear was. Or you would see the sweat marks all down her shirt or her dress or whatever, except where the underwear was. So she would put on something underneath, or she would try to have a jacket and a camisole that she could remove the jacket if she had to. But if it was a dress or a one piece, she would put something to help hold the sweat. That's probably the best way that I can put it. Yeah.
Okay. All right. I'll take Sister Glendine. Your hand was raised, and then
the other questions in the chat.
Yes, I think you may also have a question in your chat as well. So you can probably check there. And then I have some other questions here. Sister Glendine, I think you're...
Hi, good night, to everyone. You gone off on what I was saying in terms of the vaginal. I remember going to a women's retreat sometime in St. Philip that the conference had on. They were dealing with menopause, and I heard a lady say that you can pank in the Vaseline. So I just want to know if that is so.
Wow.
You said nothing you can use in your home, but she said about Vaseline. So just give me your information about that.
Well, I would have to stay with the nothing in the vagina, especially nothing oil-based. Vaseline is definitely something that would change the chemistry of the vagina and cause problems, cause infections and those things. I can't speak as to where the lady would have gotten her information. I can only speak as to what the doctors would have said to me.
Okay,
she wasn't doing the presentation though, but she wasn't doing the presentation. This was a lady in the audience saying this, so that's not false information that somebody bring to us. That was
understood. Okay. I'm not sure how the Vaseline would have helped.
It probably make it greasy and slippery.
Okay. Understood. But I could also see some challenges with that.
I've also heard, pertaining to that, I've also heard the use of linseed, using that as a lubricant. I've heard that mentioned.
Well, I guess in theory, I can understand why some person may wish to use or decide to use linseed as something that is readily available at home because it has the requisite
Texture
texture.
of it, yes, yeah. So I've
But
heard
okra slush also does. So I'm not sure why they would choose one thing over the other. I just know that all of those foods, all of those things, they change the chemistry of the vagina. Once you introduce anything, again, it could be soap, it could be a new fabric, whatever, that changes the
Okay.
chemistry, then you run the risk of having issues, and not always issues that you can see either. Because remember, vaginal infections, there's some that you will note something, and then there are others that you will note nothing, but they are operating and working and going further up into your pelvis, into your cervix, those sort of things. So we need to make sure that we keep the vagina as healthy as possible
Yes.
and as clear as possible from all of these external things. In the chat
Okay,
here,
so there's another one. Is there any issue where using alternative lubricants can lead to the body actually decreasing its natural production even further? That's the next question here in the sequence.
okay, I'm not saying that one, but let me answer that one and then get to this one about tablets. Not sure what person means by tablets. From my knowledge, I can't say. I think that persons only use vaginal lubricants when they have to, because for the most part, once we are in a situation where, if we're speaking of intercourse or being sexually aroused, we're in a situation where we are emotionally safe and psychologically safe, then physically our body will respond as it was made to respond, and we will have enough lubrication. So most women don't generally have lubricants as a rule in their home. So it's something that we would get when we need it. What can be suggested is that it's something you discuss with your medical practitioner or your gynecologist first, because I do know that we have varying sensitivities.
Yes.
So I know, for instance, that there are particular lubricants that I can't use. Only one particular type I may be able to use. While there are other persons who have no challenges.
Yeah.
I know some females who, when they go to the gynecologist, they have to take their own lubricant because the general brand or type that the gynecologist would use on their fingers or on the speculum is something that causes them problems. They have a reaction to it.
Wow.
So speak to your medical doctor about it. This question here, some of the long-term effects of using vaginal tablets and using vaginal gels for lubricants. The tablets, I'm not sure what the person means by tablets.
I think there are some effervescent tablets that are sometimes given to use
As lubricants?
As, I don't know if as lubricants, but maybe
I know there are
as
tablets
like
that are given for medication.
Yeah, or like if you have yeast infections or stuff
Right,
like
that
that.
is medication.
I think so. I don't know if maybe that's what the person is referring to when they ask about using tablets.
Okay. Well,
could be
maybe they can clarify, because they have the vaginal tablets and the vaginal gels for lubricants separated as two separate things. At least that's the way that I'm reading the question. It says, what are some of the long-term side effects of using vaginal tablets and using vaginal gels for lubricants? If we're speaking of the vaginal tablets as the medication is given for a particular issue. And once we follow the medication or the directions given with the medication, then the issue should resolve itself. I know a lot of persons may have vaginal yeast infections and they get medication to take for it, but they do not pay attention to the fact that in a lot of cases, depending on the type of infection it is, their husband, their partner needs to get medication as well, because he may not have any manifestation of it, but they would keep being reinfected with it. And then there's also, I remember the gynecologist would have said once that you need to wash all your underwear and press them and then put them up. So you press them and then you fold them up. You're pressing them because you want to apply a lot of heat to kill any bacteria that is still in it. Because
oh my.
a lot of the vaginal infections, they will live in the fabric. So again, you will be reinfecting. So you would have done everything the doctor said to do. You would have taken the medication for the 7 days or whatever, and you believe that but then you reinfect yourself with your underwear.
So then it will be key for this part then to definitely have cotton underwear.
Yes, sorry, I was operating on the assumption, and I should not have done that. That
Yes,
we wear cotton. Cotton is the fabric of our lives. Not promoting any particular brand, but
okay,
but
I got you though.
We should wear cotton. We should wear underwear that is breathable. Just as the suggestion is going through menopause, we should wear fabric that is breathable, that allows the air to pass through. We really should not be wearing any of the synthetic fabrics in terms of our underwear. I know some of the more sexy ones may not be cotton, but it's about health.
Yes.
And if we're looking for sexy, we don't keep on very long. So
true.
what we are using on a daily basis should be something that allows air to pass through. So a lot of tight pants and the jeans and those sort of things we have to be careful with. And one thing that I don't recall mentioning, when we have these challenges, the vaginal atrophy, the walls thinning, the dryness, etc., we are at greater risk to infection, greater risk to sexually transmitted infection, as well as greater risk to yeast infection and those other things. So our body is way more sensitive. So we have to be very careful. The other part of the question, using vaginal gels for lubricants, long-term side effects. Usually what happens is we go into perimenopause and we have this influx of symptoms. It seems as though everything is happening. But then as time progresses, it tends to wane and taper off. So it is not that we're using these things forever or for 10 years or anything like that. We're using them for the particular point in time when they are needed. Again, the suggestion is speak to your medical doctor, because you may need to figure out which thing is best for you. The ingredients and all of those things are there, they're clear. You can do your research and determine what you're going to put in your body. And it's not just about intercourse, it's about being able to function on a day-to-day basis. Because that lady that's said to me, like 2 pieces of sandpaper rubbing together, I cannot imagine walking.
Neither, honestly.
And that is the feeling that I'm having, and being able to still focus, and being able to work and still being able to do what I have to do.
That will definitely impact. Yes.
So let me scroll.
We have another one here. Knowing that menopause will occur with us as women, is there anything or any things we can do prior to it happening?
Oh, okay. Right, that's that question. I think that, as everything really, menopause or anything else, education is always key. When we don't understand something, it causes us more problems than if we understand. So we need to educate ourselves, and we need to prepare. We need to educate the persons around us. We need to educate our partners. Because lots of times, I remember your doctor saying usually what happens when the female goes into menopause, and the testosterone level may rise and the estrogen level may fall, and she may be all interested in having intercourse all the time. Most of the time, the male's testosterone is falling then, and he might not be as interested or as able to keep up with her, and they may have some challenges. Or then, because of the issues with lack of sleep and the way that you view yourself and the hair and all those other things, we don't feel so good about ourselves. We don't feel so attractive and all that stuff. And there may be problems that arise within the relationships that don't have to, if it is something that we're doing together and something that is understood. So educate as much as possible and prepare yourself emotionally for it. The other thing that I would suggest, those stress management techniques, the self-care, the exercise, all of those things. We don't necessarily have to have medication unless it is an extreme case. But those things that we can institute in our lives now, they will benefit us now before menopause. Exercise always benefits. Self-care always benefits. Knowing how to manage stress always benefits. Do those things. Make them a normal part of your routine, a normal part of your life. Invest in sleep. Have a sleep routine. Have a practice for when you're going to bed. Do those things so that when you go into perimenopause and these challenges come, it is not, what do I do now? What are all these things that I'm supposed to, you're already doing them. So the way that you approach the situation and perhaps the impact it has on you could be very different if you prepare. Does menopause cause high blood sugar?
Blood sugar, yes. That's the next question.
The best way for me to answer this is to say, let me respond as a mental health practitioner because I'm not a medical doctor. But what happens when we have a mental health challenge, if we have anxiety, if we have depression, whether as a diagnosis or something that is a reaction to the situation, so it may be temporal, is that they exaggerate every other issue that we have. So if I have anxiety and I have diabetes, or I have the potential to be diabetic, or I'm pre-diabetic, or it's in my family, the anxiety will exaggerate that. So my blood sugar can go up, it can spike. If I have high blood pressure, it will exaggerate that. If I have any other chronic illness, it will make it seem worse. It will flare more. I will have more challenges than what I'm accustomed having. And that's because of the mental health issue that I am dealing with. And then the way that I interpret the physical illness and the tolerance level that I have, and all those things will be impacted. So I can't say definitively. There's a question that I would suggest you ask the medical doctor if it can cause it. None of my research has said that. But what I do know as a mental health practitioner is that mental health challenges can basically blow up physical health issues and make them bigger. It can cause things to happen. You know, lots of times we say that stress makes you ill physically, and it is true. It puts pressure on your system and you develop various illnesses, or the illnesses get worse, etc. So in that regard, it can impact your blood pressure.
Okay. Next one, is it normal to be fearful during this period to the extent where you do not want to leave home or even interact with others? And if so, how can this situation be remedied?
Okay, I'll respond to that and then go back to the one that you jumped over.
I jumped on? Oh.
Yes. All right. So I think it is for some persons, it is normal to be fearful, but that has to do in a lot of cases with the way in which you handle unknown situations or difficult situations. So it's more of your coping mechanisms. And for those persons who may not have very strong coping mechanisms, or what they would have done previously, if they apply it to going through menopause, it does not work. They can have some challenges to the point where you don't want to leave home or interact with others. That is a red flag for me as a mental health practitioner. That is something that you would need to speak to somebody about, because that's indicative of a type of anxiety that we need to work with you or with the person on. As much as it is challenging for some persons, for some more than others, and the experiences vary from one person to another. Any situation that has you afraid to the point where you don't want to leave home and you don't want to interact with others is a red flag, and you need to reach out to a mental health practitioner. Have your tribe, your friends, your church, have those persons pray for you and keep you lifted up, but speak to a mental health practitioner so that the anxiety can be addressed.
Okay.
The question prior, the person is asking what's the purpose of the vibrator. They said that they joined the meeting a bit late. So the vibrator in this situation, I was speaking about vaginal and vulval issues that you may have during menopause. Speaking about vaginal atrophy, which is the thinning of the walls of the vagina. Speaking about decreased lubrication and dryness, and not as much elasticity, not stretching as much, those things. The vibrator is used as a tool, and it is something that the physiotherapist or the medical doctor will direct you in how to use it. So you're not using it for intercourse, you're not using it to be stimulated sexually. They will tell you specifically where to target it so that literally the vibrations, the pulses, can address particular aspects of the vagina. I would have also spoken about pelvic physiotherapy, which is similar. They have probes which are shaped like a vibrator that you purchase for yourself, and they attach to their machine, which do the same thing. They have particular pulses at particular speeds and particular strengths that address particular areas in your pelvis through your vagina to help to deal with incontinence issues, to help to deal with those other issues that I would have mentioned. So it's just a tool that is used or that can be used to reach particular parts. And the final thing that I did say about it is that a lot of persons may ask, so why don't we just have intercourse? Yes, intercourse can help with some of those challenges, but intercourse is not targeted like that. It's not scripted like that. So if I'm supposed to touch an area that is 3.5 inches to the left, intercourse is not going to target that, or the act of intercourse is not something you can script in that way. So the vibrator is just a tool that can be used.
Okay. Another question is it possible to get pregnant during menopause?
Yes, it is.
Okay.
I grew up hearing about menopause babies.
And if so what are some ways that you could probably
prevent it? The same way that you prevent it outside of menopause, you need to make sure that you still use a contraceptive method. Again, something to be discussed with your doctor, because for a lot of persons, when you're in menopause, you can't use the same contraceptive methods that you would have used when you were younger. So you may not be able to use the contraceptive pill or the injection, but you may have to use female condoms or male condoms or some other method or contraceptive form. You need to make sure that when you're going through menopause, until you have been declared in postmenopause, that there's still some contraception employed, because you can become pregnant.
Okay. Well, a tip here, I think this is one of the tips I think this was based on when you were talking about ironing your underwear. So I guess this tip is to sun your underwear. I guess to sun your undies, put them out in the sun for the heat from the sun to also work on that.
I guess that's something that we were always told to do as well. I think what the doctor said is that we hang our underwear in the sun, and we're told to hang it, with the seat out, that the rays of the sun can hit the seat directly. That's not always possible. It's not always something that we can control, and it's not always something that we're sure of. So the ironing was an extra measure to make sure that if that was not as it should have gone, it did not work out as it did, that we know for sure that there was heat applied. But yes, underwear in the sun is always recommended.
The next comment is, or don't wear any at all.
I totally
don't
agree
know.
with you.
but for those with incontinence, that might not that might not be
See,
so
it's a
good.
catch-22.
There we go. Yes.
Well, what I
Okay.
would say, I know there's some persons who, when they're at home, they don't wear underwear. They only wear underwear when they leave home.
Makes sense to me.
To me too. But you have to find something that works for you.
True.
Yes.
That's true. I don't know if you have any other questions there, but I don't think that I am not seeing any
I
more.
see something here. Vaginal tablets estradiol was issued to help replace estrogen. Oh, okay. This is in reference to the previous question where we were wondering what the tablets were that were being referenced. So it's vaginal estrogen that the person was speaking about.
Okay.
So
okay.
this, whether it is a tablet, whether it is a cream, the Premarin, any of those things, they are used to help to replace the estrogen, to help with the vaginal issues and to help with the progress through menopause. Because remember, the estrogen levels drop significantly during menopause. I think that for persons with particular histories, remember I mentioned I can't use any estrogen at all, no phytoestrogen, nothing. That's not something that I would be able to use. For persons who had particular types of cancers and had certain types of chemotherapy and whatever, that's not something that would be recommended for them. But for other persons, if it's recommended and it helps, because as the individual, you're the one able to determine whether it is helping or whether it is not helping with your situation. If it's recommended and it helps, again, it's only for a particular period of time.
Okay.
I don't see.
Right. I don't see any more either. So that looks like it. I don't know. I don't see any raised hands either.
Just one other comment, and this person just underscoring the fact that everybody's experience is different.
Yes,
So as much
definitely.
as we would have shared all of these signs and these symptoms, signs being what other persons can see and symptoms being what we experience ourselves, all of these things, it does not mean that will be anybody's experience. There are some persons who didn't even know that they went through menopause beyond the fact that they didn't have a period anymore.
That's true.
Okay, I just went through. I didn't have any issues. I was good. There are some persons like that.
Yes, and so sometimes they don't understand when another person is saying they're having these things, because for them it's like, I don't have a clue what you're talking about. And then there's some persons who are so very sensitive. They're sensitive to smell. They're sensitive to touch. Sometimes for some persons, it's almost as that they're having morning sickness. Yes, that they're having morning sickness and what's not. So they're sensitive to touch. There are some women who, like you said, they don't want to have intercourse at all, because that's another thing. So any noise, any for some, it is so very particular. So everybody goes through something that's very different. So some may be like me, that, as I said, I am playing menopause bingo. Versus I'm just ticking it off, and then I'm saying, oh, bingo, I have a bingo that way, and then I have a bingo, So everybody's experience is different. And some things I am learning that there's some things come and go. So at one point, it is something that is happening now, and that's the one thing. And you probably think that that's something you had before is gone, but no, that's probably just taking a little backseat until it's time for it to come back again.
That is true. That is true.
So there's no one thing that happens, and there is no one fixed it all either. You have to find what are the different ways in which best suits you, because everybody's body is still different. So you go through different things.
Indeed.
All righty. I just want to thank you so very much, Shantae. It was a very good presentation. For sure, we got a lot of tips, and we got some tips, we got some tricks, we got some ways in which can help us to manage menopause so that we shouldn't have to suffer in silence anymore. There's a lot of knowledge that's out there. We got it firsthand here, but there's other places that you can go as well where you can read up. You're unsure of things, you can talk to your gynae, different person, your gynae, your medical doctor, whoever that you can speak to, so that you can gather more information. So the time for us for this subject to be something that's taboo should be no longer, because menopause affects our lives in every aspect. It affects our home life, it can affect our work life, wherever it is that we go, our social life, whatever. It has an impact. So we learned tonight.
I just want one other thing. Somebody's saying, what about dry mouth or eyes tingling or numbness? These are things I hear people speaking about.
Yes.
Again, everybody's experience is different, and some persons do have these. Yeah.
For sure. Yes. So, ladies and gentlemen who may have joined us, menopause shouldn't have to result in us suffering in silence or to cause a pause in our life. So I implore you to, as I was saying before, gather as much information, prepare yourselves for it. But above all, we can always ask God to help us through it. There's nothing that's impossible where He is. It is a transition in life. It's a part of who we are. We will go through it, good or bad, whichever way. But I just want to encourage you to make sure that in all things, we give God thanks. This is just another part of it. It doesn't make sense for us to be miserable or to add any more misery to what we may be going through, but to just give Him thanks. Trials and tribulations, all things that we will go through, but we will still rejoice in these things because we are alive, so we can still give thanks for these things. So thank you, Shante. And I just want us to bow our heads as we have a word of prayer as we get ready to go. So let's bow our heads. Father, we thank you. We thank you for the session that we have had tonight. We thank you for the wisdom that has been imparted. And we just want to thank you, Lord, for being there for us throughout these situations. Nothing catches you by surprise. You made us. You are our creator. You are the potter. And because of sin and different things, yes, these are things that we go through in our lives. But there's coming a time, Lord, when it is that we will be restored. And my prayer is that each and every one of us will live for you so that we can see you, so that these things can be removed from our bodies, because it is that we will be living in eternity with you, where there will be no more sickness, no more menopause, no more death, no more mental health issues. All those things, Lord, will be passed away, because we will be living peacefully and joyfully with you. So I pray that you'll continue to be with us, continue to bless us. And I want to say a special prayer, Lord, for those in St. Vincent right now. Pray, Lord, that you will take care of them. Nothing is too great for you. So yes, Soufriere is huffing and puffing and doing its thing. But Lord, my prayer is that you will protect them, and whatever measures are being put in place, that everything will be done safely, and that you will keep them safe, Lord. So we give you thanks in Jesus' name. Amen. Thank you so very much, ladies and gents, for being here tonight. And for sure, listen out for when our next TNT Women's Edition will be coming. That should be sometime next month. So just listen out for that. So we thank you for being with us again.
Thanks, Shante. Great session. Great job. Thank you.
Have a good night, everybody.
All right. Good night. Bye-bye.
Good night.
Bye. Great job.
Bye.
Created for a mission, I was brought to this world to preach to every kindred of His mercy and love. In every kindness I show, in everything that I do, I've been chosen by my God to testify. A woman of God, I'm His masterpiece, chosen, loved, and redeemed by His love. A new life I was given to serve. I accept your call. Here I am, my Lord. Wherever I go, I will tell, and forever will I shout and sing. Lord, I will go. About His redemptive love, sharing God's love and mercy, forgiveness and joy. I will not be afraid. God is walking by my side. I will go forward with His might. The ending is near. I will man of God, His masterpiece, chosen, love, and redeemed by His love. A new life I was given to serve. I accept